Hello and welcome. My name is Dr. Calliope, and I'm going to be performing your HEENT assessment today. HEENT stands for head, eyes, ears, nose, and throat. Basically, everything from the clavicles up, we are going to be assessing today. We'll start at your head and work our way down. Now, I would like to start by taking a peek at your scalp with a little lighted tool. And I'm just going to be running my fingers through your hair, peeking at the scalp, using the tool to illuminate any particular areas I want to have a look at. Is that okay with you? Excellent, thank you. So let me just get the right color here. Okay, so not red or blue, green, pink, purple and pink, orange, yellow, but instead this warm white going into this cool white here. So I'm going to be looking through the hairline. We're going to go all the way to the top of that here and even into the back of that. And just take our time and look around. We're looking for signs of lesions or skin abnormalities. I'm just going to part the hair here. Move that over. We're looking for signs of injury or trauma, like a bump to the head. And we're looking for signs of infestation, like lice. Just while we're here, just to be sure, I'm just going to part the hair here. Okay. We're going to have a nice long look. Go around the ears. Just follow the hairline back along that. Okay. And we're just going to move this over here. We can look a little bit closer at this other side. Is it raining quite a bit out there then? Yes, it's kind of been off and on here. You don't look too rain splattered. Yes, a nice, cool winter rain. Okay, I'm just going to flip there this way. Then we can look over in here. Right. Okay. Yes, it's been a fairly quiet day. Most people want to stay home. And I do not blame them one bit. It's one of those perfect days could grab a book, throw on some music, some fuzzy socks, blanket, and hang out. Okay, we're going to go around the ear here. Good. Just around here. Okay. So let me adjust. Where was your part originally? Okay, let's go ahead and just bring that back. Smooth that all out. Even though I'm going to be mussing it up a bit more. Let's see. Okay, so now we're going to be palpating the head. So I'm going to be feeling the contours of the skull, checking for the valleys and hills that should be there, seeing if there are any that should not be. Back of the head, side. And is there any tenderness here as I palpate? Good. I haven't seen any injury that would line up with our observations. Good. It's right here. Good. Now our contours feel correct. There's our occipital ridge there. Okay, frontal bone, parietal, temporal, and just this little teeny bit of the sphenoid. Okay, very good. Let me just jot down a few notes. Wonderful. Now your eyes. So I have here in your medical history here, it looks like you have had an eye exam recently. Is that correct? Yes. So let's see. Okay, good. So we are going to then test your visual fields, your peripheral vision. We're going to test your extraocular movements. We're going to look at the eyes themselves, look at some of the responses. So I'm going to have you just look at my nose right here. Okay? And I am going to flash some fingers here, and I just want you to tell me how many fingers you see in your periphery while you're still looking right here. Okay? All right, so just tell me how many fingers you can see. 4, 5, 1, 4, 2, 1, 2, 3, 5, 5, 4. Wonderful. I am going to have you cover this eye for me. Cover this side. And we're going to do that again, testing just this eye. So just tell me how many fingers you see. 2, 3, 1, 4, 1, 2, 4, 5. Now if you could close the other eye here. Close this eye. This side. Good. Just keep looking right here. 2, 3, 5, 1, 4, 3, 2, 2, 3, 5. Excellent. You can uncover your eyes, and we're going to do a little variation of that test in which I'm going to ask you if you see the wiggling fingers, okay? Keep looking right here. Just tell me if you see my fingers wiggle. Good. Yes. Very good. Yes. Good. Good. Yes. Good. Good. Yes. Yes. Good. Yep. Yes. Okay. Now again, if you could cover this eye for me, just tell me if you see the fingers wiggle. Good. Yes. Yep. Good. And switch to the other side here. Good. Yes. Good. Yep. Yes. Okay. Go ahead and uncover your eyes there. Now, our extraocular movements test here, we are going to be using the Asterisk test. And then we're also going to be able to test your accommodation reflex after that. So, I'm going to have you look at my fingers right here. And I'm going to have you follow them using only your eyes without moving your head, all right? Okay, we are going to make the shape of an asterisk. And we're just going to go in each little direction, back and forth. Just these short bits for a moment. Good. And then we'll go these long bits. There we are. Good. And are you feeling any sort of odd sensation as you're doing this? Any difficulty? Does it feel like the eyes are twitching at all? Good. Now I'm going to be bringing my fingers in. Keep following them. Good. And now out. In. Out. In. Out. Good. Now if I could have you just close this eye. And we're going to do that again. I'm just going to test this eye. So just follow my fingers. And we are testing all 6 cardinal directions of gaze to make sure that all of your eye muscles are working correctly. Good, and bring that in and out, in and out, in and out. Good. You can cover the other eye for me. Very good. Do that again. Down, up, down, diagonally up, down, up, down, side, 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 diagonally down, up, down, up, down, up, down, up, in and out, in and out, in and out. There we are. You can go ahead and uncover your eyes. So I'd like to take a little peek at the eyes themselves, the conjunctival tissue, the sclerae, little lacrimal glands. I'm just going to have you look straight ahead for me. And we're going to see. So the eyebrows are intact, no loss of the outer third. Eyelashes are intact. Sclerae is the normal gray-white. Lacrimal glands are pink and clear, no discharge. The irises are gorgeous. And the pupils are both currently equal and round. And I'm going to be pulling down on your eyelids. I'm going to have you look up for me. Okay, let me just pull down. You look up. Conjunctival tissue is pink and moist. I'm going to pull up and you look down. You look down. Down, down. Good. Yes, excellent. And if I could just have you blink a few times for me. Blink, blink, blink. same speed, work at the same time. Excellent. So, I'm going to be turning down the lights so that we can do a few tests with a light here as well as my ophthalmoscope. So I will be right back. Everything is going to get quite dark. So now we can use the pen light here, my little flashlight, to look at the pupils. And I'm just doing this to look at the pupils without introducing too much light here. Good. Now I'm going to have you just look at the wall over here. Good. And then right back here. Good. Just keep looking right there. Good. Just look straight ahead. Good. Mm-hmm. Yes. Good. Good. Mm-hmm. Yes. Okay. We are equal, round, and reactive to the light. Now, I'm going to put my hand between your eyes so that the light doesn't spill through on the other side. We're going to perform the direct consensual response test. Just keep looking straight ahead. I'm going to look at your direct consensual, direct consensual response there. Good. Other side. Direct consensual, direct consensual. Excellent. Keep looking straight ahead. I'm just going to be swinging the light from one side to the other. Look for an afferent defect in the nerves. Good. Good. Excellent. So now I'm going to be shining the light at the side of your eye. This is called an anterior chamber depth test, and it's a test for glaucoma. Looking at the shading on the eye here, so you'll just get this little bit of light. Good. Okay. And on the other side, just shine that at the side. Okay. Good. Now, we are going to keep the lights off for just a little bit longer because we are going to do a test called a fundoscopy with my ophthalmoscope here. So I have the base of my tool. We are going to get the ophthalmoscope head, and to prepare the tool, there's this little dial here that gives us green or red numbers. And we're going to zero that out so that the number there is white 0. We are going to screw this into the base. And test the light. There we are. So we can adjust the dial if we need to for someone who is more nearsighted or farsighted. And I'm going to put my hand on top of your head so that I don't run into you. And I'm going to look for what's called the red light reflex. And, oh, there it is. It's the same kind of phenomenon that if you remember old photographs, people would have red eyes sometimes. It's the same reflex. I'm just going to get in real close. There we are. Until we can see the retina. So a fundoscopy involves the inspection of the fundus of the eye. That's the back of the eye. So we can see the optic nerve, the optic disc, the blood vessels, the retina, and even a bit the macula. And we just take a little peek. This is especially important in people like diabetics. And we're just checking on the health of the eye. There's our reflex, and we come in real close till we see the retina quite well. And everything here has kind of a bit of an orangey, yellowy tone to it. Isn't it fascinating that with just a simple tool we can look inside of the eye? We can see one of the nerves. Fascinating thing. And there we are. Okay, blood vessels, optic disc, and macula, retina looks just okay. I'm gonna back off. And then we're going to undo our ophthalmoscope to prepare for our next part of the exam involving the ears. And we are going to pop on the otoscope instead. Now, I'm going to go flip the lights back on. I'll be just a moment. Now, we move on to the ears. I'm just going to be taking a little peek at everything. And the whole structure here is called the pinna or the auricle. All this cartilaginous and fleshy structure here. We can look behind the ear, in front, and the external auditory meatus. So that's what I'm doing here. I'm just taking a look and feeling around. Let me know if this is painful at all. Okay. Just looking behind the ear for lesions. Okay. And then this side here. Good. Behind the ear. Okay. No pain or tenderness? Good. Now we will get our otoscope, which we've attached to the base. We have a little light here that likes to be persnickety. And then we can grab a new speculum and attach it like so that we can take a look inside of your ears. I'm going to pull the ear up and back because that straightens out the ear canal so that it's easier to place the otoscope inside, and then I can take a look. Okay? Alright, let's just go up, back here. And then there we are. We can take a look. In the external auditory meatus, we look for signs of injury. We look for any little irritants, signs of irritation. We look at any cerumen buildup. We look at the tympanic membrane, which separates the ear canal from the little ossicles, the internal ear. Those are the malleus, incus, and stapes, little ear bones. And the inner ear is all of the little structures like the cochlea. We have the eustachian tube. We have the nerves back there. That's not what we can see here. We can see the tip of the malleus, and the tympanic membrane, and the ear canal. Which is certainly very important. So I'm going to look on the other side as well. And we look for the color of the tympanic membrane, which is supposed to be a pearly gray color, semi-translucent, which is where we can see tip of the malleus, as well as something called the cone of light, which is a reflection of the otoscope light, the tympanic membrane. We can look at the shape and structure of the membrane, look for signs of infection, that sort of thing. Of which it looks like we have no issue with. Let's take a couple of notes here. Otoscopy. Really gray. Distension. Good. Now, I have a selection of tuning forks here. They vary from 2048, this I believe is 128 hertz. We're going to be using a few of these to test your hearing. We're going to be using this guy for our Weber and Rinne tests. So let's start, I think, with the easiest to hear, the 512. I'm going to test one ear at a time. If you could just tell me if you could hear this. Good. Yes. Very good. And 256 can be a bit more difficult. Very good. And now the most difficult. 128. Now the other ear. Yes. 256. Good. And 128. Now we'll put these back. Save for our 512 hertz tuning fork, which is standard for a Weber and Rinne test. The Weber and Rinne test involves the Weber test, in which I would put the tuning fork right here on your head, and you tell me whether you hear it more in one ear, the other right in the middle. And the Rinne test, in which I put the tip of the tuning fork on the bone behind the ear, mastoid process, and we wait until you stop hearing it. We bring it in front of the ear, in which you should be able to hear it longer than you did right here. And you tell me when this stops. Okay? So. one side, the other, right in the middle. One side, the other, right in the middle. Tell me when you hear this stop. And then it stops when I make it stop. Stops. Very good. Stops. Stops. Excellent. Very good. Now, we're going to take a look at your nose, your mouth, throat, and neck. For the nose, I'd just like to have a look at the external structure. And I'm going to press on the nares here. Any pain or tenderness? Good. Okay, and the septum. An external inspection is midline. Let's grab a new speculum. Let's take a peek inside. I could have you dip your head back. Good, and this is not going to go inside the nose, but it's just in case it does. And we're going to look at the nasal passages, of which they're clear, pink and moist. Septum, no perforation. Midline, and the turbinates. At least everybody but the superior turbinates. Good, on the other side. Okay, so nasal passages, septum, and turbinates way up in the nose there. Good. You can bring your head back down. We're going to look at your sinuses. So, I'm going to be pressing on the frontal sinuses, the ethmoid sinuses, and the maxillary sinuses here. So, let me know if this is painful at all. Okay. Good. Okay. Now I'm going to be tapping along these areas, directly percussing them. And this is a bit of an accentuation maneuver in which maybe the pressure doesn't feel tender, but the tapping might. Okay? Good. Good. Excellent. So, Nose looks good. Now we're going to look at the mouth and throat. And I'm going to get my flashlight and my tongue depressor. And we're going to start with the pharynx, which is going to be the throat here, just above the voice box. I'm going to have you open your mouth and say, ah. Good. Stick out your tongue. Okay. And let's look at the pharyngeal wall. So, smooth, pink, no cobblestoning or irritation. Okay, good. And can you say ah again? Alright, uvula, bilateral there, so cranial nerves 9 and 10 are intact there. We'll double check that vagus nerve with the swallow test as well. Okay, and hard and soft palates. Good. Now I'm going to look at the oral tissue, just the pocket of the cheek here. Look at little salivary glands. Do that there. There we go. Good. Can you stick out your tongue? And then lift it to the roof of your mouth. Good. Look at the teeth. Good. No caries upon inspection. Very good. I'm just going to dip the lower lip down and the upper lip there. Okay, good. And you can go ahead and close your mouth there. Now for the neck, I'm going to have you do a swallow test. We're going to look at the thyroid, but it also checks for dysphagia or dysfunction, inability to swallow, which can tell us a little bit about our vagus cranial nerve. So if I could have you just take a dry swallow, like so. Good. And then I'm going to palpate the thyroid, the isthmus, and the lobes. Good. Okay. And then we're going to just palpate the lymph nodes, and that will conclude our examination. So we're going to start at the back here, at the occipital nodes, in the back of the head. And then post-auricular, behind the ears, pre-auricular, submental, submandibular, under here. Let's go. Post-auricular, pre-auricular, using rolling motions here, and submental and submandibular. Just taking the skin and rolling it. Good. And our cervical nodes are named in relation to our sternocleidomastoid, which is this real big guy here. So we have anterior cervical are in front, posterior cervical are behind, deep cervical chain are underneath. So we've got anterior cervical here, posterior cervical, and then deep cervical chain. And the last guy is the supraclavicular nodes. We have the clavicle here, supra meaning superior, meaning above. We have the supraclavicular fossa. We're going to just palpate in here. Good. And we're all good there. Okay. So we have a few things to note down here. And the good and non-tender. There we are, very good. Okay, so let's take a little peek. We did the head, eyes, quite a few bits there, ears, nose, mouth, throat, and very good. So that will conclude our examination unless you have any questions at all. Okay, very good. Let me go ahead and sign off. And I will bid you adieu. I'd like to thank you so much for allowing me to perform this HEENT assessment on you today. You are an absolutely model patient. I do appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you.